Okay, so another one that we wanted to talk about was hypoxia, so low oxygen. And we were talking about in the shock part that having an oxygen saturation probe could be useful. And well, that's another part that could be useful. So then now you can monitor also how much oxygen they have. And so why is the hypoxia so bad? Well, there's some studies that have shown, especially for head injury or spinal injuries, that so anything that has to do with the neurology, that if you get a different decrease in blood pressure, or if you have low oxygen that gets to your the head, that I think the mortality was increasing, like for each episode that you have, it increased by 10%. So like it goes pretty, or double, something like that. So it's pretty high with this, and it's basically because our brain, and this is why, for example, we need to eat, and we don't live very long without oxygen, is because our brain really needs a lot of oxygen and cannot really live long time without it. And so a lot of time people don't think about that, and they'll focus, let's say, on decreasing like the oxygen, like decreasing the bleeding, but opening the airway is very important. And this is where also there's a little bit of a confusion. Let's say I open the airway. Airway is a ventilation, and that means is how much the CO2 will get out, but that means that the person has to breathe. But if I open the airway but I don't put any air inside, the person, let's say the person start breathing or breathes at 2 minutes, and usually our regular thing is about 16 to 20. We're more on the 20 side than on the 16, maybe when you're a teenager or you're well, like a big athlete, but you're more around the 20. So that means if I'm breathing, let's say even at 8 breath a minute, that means that the air doesn't come in. If the air doesn't come in, no oxygen comes in, and I cannot let go of my CO2. And if the CO2 raise too much, it start playing also on the brain. And so why am I keep talking about brain and people that doesn't breathe and stuff? Because a lot of time the patient that will not breathe very carefully would be people with brain injury. So somebody that went over the handlebar or whatever, banged their head, and suddenly they have decreased level of consciousness, and so they don't talk as much and stuff, and their breathing start changing and everything. So we have to make sure that we breathe for them, and to have to make sure that they reach a certain amount of things. And I even have a personal story about that, is that one time I was on I was rollerblading on my day off, and then when I got on place, there was a car, there was an accident. So it was another rollerblader. Rollerblades went up in the air and banged his head, and he was not wearing a helmet. Well, there was somebody at the bedside, and at the side, and actually that was a nurse, and she maintained the airway, and actually she was taking the pulse and holding the spine precaution. But when I got there, the person had his lips was blue, and as soon as I got there, we started to do the mouth to mouth, because that's all we had anyway. But the daughter was making the mouth to mouth, but what I did was put some oxygen, and by the time that the paramedic came, the lips were pink again. So keep that in mind, that if you have somebody with decreased level of consciousness, it's not just to open their airway. Sure, you need to do that, but the thing too is make sure that the number of breath they take is up and down, and it goes well, and the oxygen goes in. And so this is why oxygenation can go up. If you're starting to use, if you have by any chance and luck, you have an extra oxygen, that the SAT may be abnormal, but I won't get into this because it would be very unlikely that you have that kind of problem. It's just because the curve for the saturation kind of does this loop, and then it's stagger like this, and so when you use oxygen, it can get you into other different problem. But it's very unlikely that we have to do this. But the person that needs to breathe, there's two reasons. Is I need to push air in, but not just to bring air in, is to bring also the air out. So to do the mechanical movements, you have to make sure that the person breathes. And so looking at lips, mostly they'll become like cyanotic, so that means blue, or also having the SAT. And so if the SAT is below the 90%, then unless the person is smoker, but even 90%, just keep that number. So even if the person smoke or have bad lungs and stuff, anything below 90 in the trauma is pretty bad. So you want them much higher, closer to the 100% that you can. That's the best thing. So that's another point for the O2 SAT that you can put. And on a side note, when you're using the O2 SAT, another use that can be, and so for example, if you have a breaking leg or stuff and you start feeling the pulse and you have good perfusion, and you put the saturation. So for the saturation to have it has to have a good perfusion and to go to the machine. So if you're about to do a transport or you're monitoring other stuff, putting the SAT on the member. So if you say if I broke this arm, to monitor it, I can put my saturation probes here. If it start reading, if it start giving me alarms that it's not reading properly, then I can start coming and checking. Because if, for example, the bone or the swelling compress the vessels that gets the perfusion on my fingers, that means that this O2 SAT can monitor that, because now I can say, whoops, hey, I'm not getting a good reading here. So it can be an alarm in itself for that. It's not that reliable, and it's a late sign, but it is another use of a tool that you would have in those blow-up kits. So that could be another use for the SAT. But yeah, hypoxia is one to think about. And if you ever think about using the bag valves mask and to buy, don't go, and I'll put some videos down, but don't go with one person, one bag valve, because it's very hard, it's very difficult to do. Even people that are well trained, there's some studies that have shown that it's not very efficient. So have two person, one that holds the mask and the other one that bag. But if you're by yourself, go mouth to mask. That's the best way to go. That's the best way to do it. When you think about this, not just airway, but think about also how much they breathe. And if they, for example, breathe at 8 a minute, bring them back up to 16. So that means every second breath, so in between the two breaths, they do push one in. So that's called assisted breathing. And if you ever did a CPR course, it's in there. So make sure that you do that as well. Anyway, so that was for hypoxia, and we'll go on our next topic.